We've all had it and we know it's terrible. I'm talking about back pain. Up to 85% of all people have lower back pain at some point in their life. And here to tell us more about a minimally invasive procedure that can help people suffering from back and joint pain is Dr. Douglas Wan. He's a minimally invasive spine surgeon with SpineCARE. How are you today?
Doing great.
Okay, let's talk about back pain. What are some of the reasons we might be suffering that we may not know about?
Yeah, you know, the low back pain is the second most common reason why patients actually seek out medical care. Right?
Okay.
And it's only next to common cold. And the back pain related symptoms causes the 15 million visits to physicians every single year.
Wow, those numbers are high.
It's very, very high. And then it's the third most common reason why anyone has surgical procedures.
Okay.
So when we think about the low back pain, instantaneously, most of the time we're thinking about, you know, spine related, degenerated disc,
Right.
herniated disc, pinched nerve from the disc protrusion, or the bone spurs. And many physicians and patients forget to think about sacroiliac joint. And so SI joint is many literatures have stated that up to 25% of patients with any kind of low back pain, it's really related to the SI joint.
Okay, so how do you diagnose that?
Yes. So first, let's look at this model to see what the SI joint is. So sacroiliac joint is a joint that connects the spine to your pelvis.
Okay.
And on either side of the sacrum is the base of your spine. And then this connects to remainder of your pelvis. So more commonly, way of diagnosing them is, you know, first any physical examination and proper history. However, these don't necessarily tell all the story. So at SpineCARE, our pain specialists use a pain mapping process and utilizing a specific selective nerve block in order to identify that SI joint is the source of the pain.
Okay, so what are those symptoms that SI joint might be a sign of the pain? What would we be coming in with?
Yeah, some of the most challenging thing about diagnosing SI joint pain is that it mimics a lot of the symptoms from the spine problems or hip problems. Patient may have low back pain, pain that radiates down to their buttocks, pain that radiates down to their legs. Also, they may experience some weakness, numbness, and tingling sensation. Very similar to disc problems and hip problems.
Okay, so we have those symptoms. We come in, your pain mapping specialists figure it out for us. So what are the treatment options from there?
Yes. So initially, the patient, once they're diagnosed with SI joint dysfunction, then we first utilize a conservative treatment, such as physical therapy, chiropractic adjustments, you know, some oral anti-inflammatory medications, right? And then also we may utilize SI joint injection treatment.
Okay, so those are kind of the first round of seeing what we can do to avoid surgery, but then sometimes minimally invasive surgery is an option.
Yes, so if they fail the conservative treatment, that's when we utilize a minimally invasive SI joint stabilization.
Okay, and there's lots of benefits to that, obviously, I'm sure.
Yes, with the minimally invasive surgery, it's much less traumatic, so less bleeding, less scarring, and less pain, so patient can recover much faster, right? And then they're able to go back to their work and daily function much sooner.
All right, well, great information, Dr. Wan. Thank you so much for being here with us today. And if you want more info, you can go to this website at SpineCARE, DFW.com. And still to come, a live look from D-Box Inc.